Welcome back. My name is Greg Martin. We're going to be talking about risk, rate, and odds. These are concepts and terms that we use in public health and epidemiology. People often get them confused. By the end of this video, I promise you're going to understand them completely. So let's get into it. Booyah shaka. So let's start by talking about risk. Risk really is what you think it is, right? Risk is the chances of a person getting sick or getting some other health outcome that you're interested in within a certain period of time. To calculate risk, we really just need three things. Firstly, we need a defined population that we consider to be at risk, right? So we need that group of people. Secondly, we need a defined period of time during which we consider them to be at risk. And thirdly, we need to count up the number of new incidents of this disease or this health state that we're interested in that happens during that period of time. Now, if you've watched my video on incidence and prevalence, you'll notice that the way I've described risk is very similar, if not exactly the same, as the way I would have described incidence. If we have 10 people and we look at them over a period of 1 year and 3 of them develop cancer within that year, we would have said the risk of getting cancer is 3 over 10, which is 30%. Now let's talk about rate. Rate is a very similar concept to risk, but there's a small difference. In the case of rate, we divide the number of new cases by something we call the person time. And I'm going to explain what that means in just a second. To explain this, I'm going to use an example. Let's imagine, for example, that we had a study that we were doing and we were following 10 people over 10 years, right? And we wanted to count the number of them that got cancer or some other disease during that period of time. During the study, however, not everybody would stay in the study all the way to the end. Some people might drop out of the study and other people may die even during the study. And so not everybody in the study contributes a full 10 years in terms of the period of time within which they might get sick. And so what we could do, and in fact this is what we do, is we take the time contribution of each individual that they spent in the study and we add them all together and we get a cumulative person time of the entire study, and we use that as the denominator. In other words, the 3 or 4 people that got cancer or whatever disease at the beginning, that's the numerator. We divide that by the cumulative person time as the denominator and we get the rate. Now let's talk about odds. Odds is slightly less intuitive. Odds are the number of events divided by the number of non-events, or the probability of something happening divided by the probability of it not happening. If the odds of an event are more than 1, then it is more likely to happen than not. If they're less than 1, in other words between 0 and 1, then they're less likely to happen than not. And if they're exactly 1, then it's as likely to happen as it is not to happen. To understand the difference between odds and risk, I'm going to use an example. And just so that you know, this channel is sponsored by Nested Knowledge. That's a platform that supports systematic literature review